Hi, my name is Ahana Kameshwar, and this is my project about social media use in adolescent mental health. Now, social media has become ubiquitous in the 21st century. It's evolved from merely an avenue for socialization to much more. It's become a hub for entertainment, productivity, and so on and so forth. Studies have shown that over 67% of the global population uses social media. One group known for being avid users of social media is adolescents, with one study reporting that 47% of adult Gen Z users report using social media for at least 2 to 4 hours daily. While social media is often portrayed in the media as solely a negative influence, research has shown that social media can have benefits for adolescents. For example, through posts, images, stories, and videos, adolescents can share their views and opinions and express their individuality. However, social media can also be detrimental. Studies show that 1 in 7 adolescents are affected by mental health disorders, and 1 in 5 believe that their mental health problems are due to social media. Also, adults today are particularly concerned about social media and have reported that they wish social media never existed. They think social media is corrupting today's youth. In a blog from Stanford Law School, the author states that New York City has sued social media companies on account of them being a public health threat. Also, a study saw that more time on social media apps was associated with mental health issues in Chinese teens. Social media usage and mental health are connected in many studies, and most find the connection to be negative. The aims of most of the studies were to find out the connection between social media and mental health problems in adolescents, but many have vague evidence or conflicting results, which make them difficult to read up and understand. Some studies have shown that social media helped reduce perceived loneliness during the COVID-19 pandemic. In a study, researchers conducted 2 longitudinal studies on Finnish adolescents, one examining perceived loneliness and another investigating the correlation between psychological distress and said loneliness. In the study, perceived loneliness did not increase post-pandemic onset overall, but psychological distress did increase among those who perceived themselves as lonely. The author stated that social media bubbles might be advantageous during times of social distancing, but likely do not protect against increased psychological distress among lonely individuals. There are many more findings on the detriments. For one, studies have found links between social media and depression in adolescents, where psychological security is a mediator. Another one is about academic performance, where students who use social media for entertainment showed less academic performance. And also, those who doom scrolled have increased vulnerability to mental health problems. Also, social media has many implications for medical practice so that more cases will not be reported. It is important for mental health practitioners to understand the implications. For one, medical practitioners need to avoid bias in their diagnoses. Another one is that the experience of users might depend on their background or community. For example, girls may encounter body image issues, LGBTQ+ members might be bullied, and multiracial users might experience racism. Current studies are very limited, and there are not very many studies about social media and mental health. The studies that are existing are correlational, not causal, and they're also very vague. They're also based in one location, making it hard to understand the effects in other areas. Also, we need to improve policy. Media education is needed so that the youth of today learn not to overuse social media when they grow older. Also, there are not enough experimental studies, and we need those to explore beyond the correlation and make more important discoveries. To conclude, social media has become ubiquitous for all ages, but mainly adolescents because it gives them a chance to express themselves and to connect with others. It has benefits from helping with loneliness and detriments from being a key factor in mental health issues. It matters, though, that we use it properly to make sure we are free from the detriments and that parents and practitioners offer support and guidelines for proper usage. Thank you.